was just going to jump in quickly and just talk about the use of some of the wellness program really increase, or at least it heightened in the pandemic period of time. And a variety of different benefit packages certainly have uh, made every effort to increase mental health support for their current population, current employees. But having access to these various programs, like online therapy portals and talk therapy apps and physical fitness program, have a significant benefit for employees. Um, we in our organization have a whole work life program that's dedicated to that, and we also at times make sure employees understand and participate. um, the other component that I had mentioned earlier is also DEIB programs can encourage a diverse group of employees to take advantage of these mental health programs, and be supportive to the culture where managers and employees feel empowered more so, and they have this psychological safety where they can reach out and say, I need help or I need support to address a variety of different issues, including such things as, mental health and burnout, etc. Josh?
Yeah, I think employers have been so impactful in removing some of the stigma around mental health, and by focusing it on as a benefit is really it's improved access, but and improved the feeling like if you have mental health needs or need some support, some particular period of time that you're reaching out for it. I'd also, I'd remind, employers that you always want to maximize the benefits that you're already offering. And so, for many of the audience knows One Medical delivers primary care, and that's, critical for all employees and their families. But what, is important for us at One Medical is that we deliver that with, physical medicine with mental health integrated into that. So looking at how your primary care, how your employees are accessing it, are they accessing high quality primary care? And, it is important for everyone to look at. And, high quality primary care means, mental health screenings are happening at that point. And it is often where the first presentation of a mental health issue is. It's not to a behavioral health clinician, it's typically to a primary care provider. And so looking at, that aspect of the health system so that people are being appropriately treated through their primary care provider, or if necessary, kind of, referred out to other solutions that may help with, common things like anxiety and depression. I think one other area of mental health I would also point employers to think about is, the epidemic of loneliness that we often, we're hearing about, and that, that often ties to anxiety and depression, but also very much to this kind of remote workforce that we started talking about. So I think people it was an issue before the pandemic, but many people, while expressing the desire to work at home and have that flexibility, I think it also comes with, potential that they're also more isolated. And, work is often a place that's a place of social interaction as well. And so I think, thinking about sort of perks and I think employees value things that are bringing them together and help address some of that isolation.